Hello, and welcome to Health Connect.
Hi, and welcome back to Health Connect, where we discuss the latest in health informatics and insights from the industry. Today, we are diving into a topic that is at the forefront of healthcare transformation: patient access to their own health records in one place. We are exploring how this can improve patient care and reduce healthcare costs in Ontario, with a special focus on a digital solution called OneChart. Joining me today is my good friend, Ari Adu-Bekoe, a student in the Executive Masters of Health Informatics program at the University of Toronto and a co-host on this channel. Welcome, Ari.
Thank you. Thank you for having me, Obed.
So to start this, could you give us a brief overview of OneChart and its main objectives?
Absolutely. So OneChart is a digital platform that aims to empower patients by consolidating all of their data and health records in one place. The idea of the OneChart health solution was the capstone project from a master's program to idealize a systemic level digital health solution. It offers patients the ability to view and manage their their medical data through a single accessible platform. And this design is to improve care continuity, enhance patient involvement, and ultimately reduce healthcare costs.
Now, talking about giving patients access to their healthcare, I'm wondering how this is going to their improve their care. So could you elaborate on that?
For sure. So when patients can see their health information in one place, it allows for more informed decision making. So basically, OneChart, for example, uses a standard like the PSCA or the Canadian version of the International Patient Summary to ensure that health records are unified and comprehensive in an accessible fashion. This basically reduces the fragmentation of care, ensures that critical health information is always available, and empowers patients to manage their own health better. So we've seen that patients who are more involved in their care tend to have better health outcomes.
Yeah, I tend to agree to that because a couple of papers that I've read have mentioned the fact that patients who are actively involved in their own care usually gets much way better. But I am trying to picture how this is going to play out practically. So could you give us an example of how this will work in a practical scenario?
For sure. So, okay, imagine a patient who has diabetes but doesn't have a regular health care provider. In Ontario, that's about 15% of
Mm,
people that are in this situation, actually. So, without
mm.
access to their full history, their health history, they might receive inconsistent treatment when they visit different clinics or emergency departments. With OneChart, they would have all their lab results, medication history, and treatment plans in one place. So, this helps avoid unnecessary tests or treatment delays, improving all overall health continuity.
That's fascinating. And talking about 15% of Ontario's population, I think that's a huge number.
Yeah.
So let's talk about cost. How does a platform like OneChart reduce healthcare spending in Ontario?
So with the financial benefits with this, they're significant. Basically, for example, research shows that patients who use health portals, especially those managing chronic conditions like diabetes, can see substantial improvements in their health outcomes. So one study found that patients using online platforms had better control over their blood glucose levels, with 24% more users achieving a hemoglobin A1C target of less than 7%. So reaching this threshold of less than 7% is an ideal indicator of well-managed diabetes.
Yeah, that's really a great impact.
And exactly, and in Ontario, where healthcare costs are driven by managing various chronic diseases, even a small improvement in patient outcomes can lead to massive cost savings. It is estimated that 30% that a 30% reduction in diabetes complications could save Ontario's healthcare system approximately 163 million, I believe,
Mhm.
annually. So additionally, reducing duplicate testing and hospital visits can further lower these costs.
$163 million is a huge amount
Yeah,
of
it's
money over
not
there.
small
And if
change at
you're
all.
Yeah, if you're able to save that, that would be really great. So talking about saving costs, let's move on to privacy. We know privacy and security is huge when we talk about patient data. So how do we ensure that the patient data is protected on platforms like OneChart?
Yeah, but that's a crucial aspect. Privacy is built into design of OneChart, mirroring the success of the secure systems features found in the banking industry applications. So where digital platforms are highly secure yet user-friendly. So this includes secured authentication systems, biometrics, and encryption of data at rest and in transit. So all these things play into the security features of OneChart.
Oh, nice. So how does this also help with the adoption of the platform? Because I believe that for a platform like OneChart to work, adoption is key. So how does this help with its adoption?
Of course, yeah. So when patients feel their data is safe, they're more likely to engage with the platform. So education on how their data is used and protected is key to building trust. And this trust is essential for widespread adoption of digital health solutions. So as long as they know and they're aware of how their data is being protected and secured, this trust will be built and adoption will come naturally.
I agree with the trust bit, and I know that it is a huge part of almost every aspect of healthcare. If patients can trust anything that they are doing, then it's going to go a long way to help them. But speaking of adoption, how do you see the rollout of OneChart across Ontario?
So I envision the implementation will take place in three phases: integration, adoption, and sustainment. Initially, OneChart will integrate with existing systems like Connecting Ontario, allowing patients to access their records immediately. As more patients and healthcare providers see the benefits, adoption will increase, and eventually the platform will become a standard part of healthcare workflows in Ontario.
It sounds like this platform could really revolutionize healthcare. What about expanding beyond Ontario? Because if it has such huge impact, I can foresee it going beyond Ontario. So what's are the plans for that?
Yeah, that's the goal. Once we have a successful model in Ontario, OneChart can expand to other provinces and territories across Canada. The scalability of the platform and the flexibility it offers healthcare providers makes it ideal for wider adoption.
Mm, that's really great. So that brings us to sustainability. How does OneChart plan to maintain its financial viability?
Great question. So OneChart will use a subscription model, charging healthcare facilities around $100 per year for added features like appointment booking. With thousands of healthcare facilities across Ontario, this creates a steady revenue stream for the platform's maintenance and growth. It's an optional model, meaning smaller clinics that may not have the budget for it can still participate in the base interface, ensuring widespread accessibility, and not to mention all patients will have full access.
That's really great. And I think it's a great plan. And the fact that even smaller clinics get to benefit from it would be very helpful because a lot of the time solutions that come out there are for those who have the big bucks, right? So if you're
Yeah.
coming up with a solution where people or clinics that are smaller in nature such that they can even afford will still get to benefit from it, this means that the underserved population is also going to benefit from it. So that is really great. But before we wrap up, what would you say are the biggest challenges in making OneChat a reality? Because I believe that just like any digital platform, there may be some challenges when it comes to implementing or getting it into the field for use. So what are some of the challenges that you foresee?
I think policy is a big one. PHIPAA could definitely use a revision to allow easier data sharing between healthcare providers without compromising patient privacy. And on top of that, government changes and funding cycles can slow down progress. So having a sustainable model that doesn't rely solely on government funding is critical, I think.
I agree with that. Hi, Ari. Thank you so much for these insights. OneChat seems like a truly innovative solution that could transform patient care in Ontario and beyond. Any final thoughts?
Just that we're excited about the potential of OneChart. By giving patients control over their health data, we're not only improving care, but also fostering a more sustainable healthcare system. The future is bright for digital health in Ontario.
I agree with people like you. I agree that the future is indeed bright for digital health in Ontario. Thanks again for joining us today. And to our viewers, don't forget to subscribe for more insights on the future of health informatics. And see you next time.
Thank you, Obed. And
right.
Thank you for everybody who's participating in this channel. Cheers.